a few different ones, and feel free, all of you, to kind of jump in. So, how are you helping people diagnosed with mental illness? How are you helping people diagnosed with diabetes and mellitus, I believe is what it's called, or type 1 diabetes? And how are you helping our veterans in general?
So I'll talk about it in the context of our veterans. You know, the mayor touched on Mather Veterans Village, and it is a remarkable project in the sense that the city, the county, the state, and the federal government all work together, and we each had a critical role in getting the groundbreaking off the ground and getting this done. And we've still got a lot of work to do. So that is a great example of how we are all working together to serve the community, and each of us has a slightly different role. My role at the federal level is to secure the housing vouchers so that you can get the project off the ground. At the state, county, and local role, it's to get the project built. But again, it's a great public-private partnership. For the issue of homeless veterans, if you look at the fastest growing population of homeless, it is veterans that are returning from these conflicts. And within there, one of the fastest growing populations of homeless veterans are women veterans. So we have to rethink how we approach this. And one thing that I've suggested to the Department of Defense is, before you're discharged, you know when someone is leaving active duty, months in advance. There really should be an exit interview. Someone should sit down and go through a series of questions. Do you have a job that you're lined up? Is your family ready to welcome you back? Are you ready to go back to your family? You should do a health screening. You should also get the process working. Again, part of the reason why Chris and I worked on the 21st Century Healthcare for the Heroes Act is you should also start getting the process working so your records are moving over into the VA system. So as soon as you leave, you're able to step into a system. But all those are things that should be done before you leave active duty. So you can do that mental health screening. You can then start to, it's what we do, I'm a physician, it's what we do before a patient leaves the hospital, is we actually go through and put a plan in place. So that, and that isn't happening. For far too many veterans, they leave active duty and they're, essentially you're back home and you're on your own. And many of them are lost because I'm not a veteran, but I talk to veterans all the time, and life in the service and then trying to transition back into your civilian life is not an easy thing to do. And we really do have to do everything we can to help them reintegrate. Ken, do you want to?
Well, I'll just jump in. In my responsibilities, we've started doing a variety of things in the state budget as the state's budget picture improves to put money back into services that were cut in recent years, which are benefiting veterans, both on the mental health front, but also in housing and just other services. We have a tremendous number of veterans coming back from foreign wars, needing education, needing to take advantage of their GI benefits, trying to make sure that our colleges and universities can let them complete their educational program while they have GI funds available and not get it strung out and dissipated before they get a degree. On the specific issue of services, like Omni, we are just one person, and so we have members of our staff who specialize. Brian Ricks, I've got a bunch of my staff here today. Mary Ann Conroe here, Brian Ricks, John Glatz, Stephen Stinsler. Brian is sort of my emissary with the veterans community, so pretty much if there's a veterans meeting happening in the 8th Assembly District or in Sacramento County, Brian will be there in my stead. I also do a lot myself, working with our veteran service officers, supporting those organizations, getting out so I as an assembly member am at least connected with them so they can bring issues my way. You end up dealing sort of opportunistically, I would say, as a member. You look for opportunities. Since I've been a legislator, there was 2 issues that came up the prior 2 years that kind of came up out of nowhere where I needed to kind of react quickly. One dealt with taxes involving Rancho Cordova. Another one dealt with trying to help McClellan get authorization to use a couple of former base structures out of McClellan to turn them into general acute care hospitals for veterans with severe injuries that needed a higher level of medical care. And I remember I only heard about this issue in July of 2013, sitting out at McClellan and talking to the McClellan folks. And by the end of September of that year, it had been signed into law, some authority to address this issue. So I would say I, as a member, am able to support my veterans through the budget process and by making sure I am connected in my person, but also through my staff to the local veterans community. So my ear is to the ground. When there are issues, I can jump in and expedite getting help, just as I did working with McClellan. I'm very excited to see the Veterans Village come forward, which Bob has taken a key role in, but I, as mayor, also supported. And every time we had a member of Congress before Ami, we had plenty of national members of Congress coming through this area, and I would always brief them on what we were doing on the Veterans Village here, just to make sure our congressional partners knew that there was an opportunity here.
Well, I'm glad that so far we've had the help here in Rancho Cordova and at Mather. You know, Mather VA Hospital has been expanding. There is a new building now for helping the veterans who have had the really horrible things going on in Iraq, Afghanistan. They need mental help, and there's a building for that now. But that hospital and that VA hospital is beginning to expand even more. There's one for women veterans. There's another one for outpatient surgery. There's been, and the hospital itself, of course, is for the veterans that need surgery right now. I wish there was a magic wand to educate all of the veterans who come home. Many people who sign up who are in the Army, Air Force, Marines, Navy, doesn't make any difference what branch you're in. Some of them don't think of themselves as veterans because they weren't in a war zone and weren't shot at. The way I see it, if you give 2, 4, 6, 20 years of your life for your country, you're a veteran. It's really a veteran. And if you sign up and you know that you're going to get orders from the President of the United States to go to wherever, then that's where you go. If you're told to go to Iraq, that's where you go. If you're told to go to Okinawa, that's where you go. That's where I went. In 1965, the bombers from Mather and Barksdale were the first ones being used in Vietnam. Both of us lost a bomber, the first mission they had over Vietnam. I was ground support in Okinawa. That's the way you did it. You did what you were told. And, it's kind of sad when you have the veterans coming home from Iraq and Afghanistan now, and they don't really think of themselves as veterans because maybe they weren't shot at. Maybe they didn't have 20 years and they think they have to have that for they're a veteran. That's another part of the thing. You have to educate the veterans, and that's one of the things we're going to try to do on this Veterans Village when it's done. We're going to try to educate the veterans as much as we can. Get as many of them off who are living along the river right now, who are living on the streets. So that's, a mental thing is something that is really difficult to beat, but it's something that really needs to be done. And that's something that we're going to be working on here in Rancho Cordova, working at Mather. And I know that Ken and Congressman Bera are really going to be continue to work on that too, make places for them. So it's going to be a long haul, but everybody here, all of you, have your part too. You know somebody that needs some help, just pass it on. Talk to them, and if that's not the way to do it, then talk to someone at the VA hospital. Call them. They'll listen to you.
Thanks, Bob. This next one is going to be for the congressman, if we could pass that mic down. Kind of a specific question, and then in general, a question about Medicare and health services, and I know with your expertise, we're very, very lucky to have a doctor and somebody so experienced as yours. Somebody had a specific question about what can be done to help seniors obtain hearing aids at little or no cost. They talk about, the decreased hearing can lead to dementia and a lot of other things. And then can you also just give us a general update on where we are with the ACA in general in healthcare and what's happened in the last couple of years since you've been there?
Pretty broad questions there. So on the hearing aid question, yeah, we can look at the specific Medicare benefits, but obviously that should be a covered benefit in my mind. As a doctor, both vision and hearing services are obviously very important. If the person who asked that specific question, Deneen, do you want to raise your hand in the back? Deneen's in the back there. If after we finish, if you'll go find Deneen, what she could do is she can get your information. We can take a look specifically into if you're having trouble accessing some of those benefits, how we might be able to help you specifically. On the broader question of Medicare, and then I'm going to actually expand the question to include Social Security as well. These are two incredibly important programs. They're programs that we pay into during our working years so that, in retirement, we either have the security of Social Security that gives just some basic income to keep you out of poverty. And then the same thing with Medicare. You're paying into this so that when you're in retirement, you have access to health care. I talked about what we're working on as the problem solvers, and I touched on this idea of having a national strategic agenda. Well, there's 4 points in that strategic agenda, and one of the strategic agenda points that we think Democrats and Republicans should agree upon is let's secure Social Security and Medicare for the next 75 years. Now, we're stating this as a broad goal with a specific time frame. And we're not saying here's exactly what you need to do, because you first have to set a goal, and that's a goal that we can all agree on, because again, these are incredibly vital programs, and we want to make sure that they're there, not just for today's seniors, but that they're for our children and grandchildren. You'll hear Medicare talked about a lot next week, because there is a big piece of legislation that's coming up, which is how doctors are reimbursed. And it's something that I've been working on for the last 2 years, because right now the system of reimbursement in Medicare is fee for service. The more you do, the more you make. So the way you make money under Medicare in the current reimbursement is to do more, which does anyone think that's the right road? That's the wrong incentive. If we can get this right, we can throw out this flawed payment system and move it to a payment system that rewards quality and efficiency. So then the way you make money is to provide a higher quality and more efficient product. And then our job is not to dictate, here's what you should be doing, but it's to measure that quality and make sure that the patients and the consumers are informed. It's taken 20 years to try to get this flawed system changed. We're pretty close, and I am very hopeful that we get this fixed next week. This is Congress, so you never cash a check until you get there. On the broader component of the Affordable Care Act, many of you have heard me talk about this in the past. As someone who's worked in pretty much every aspect of healthcare, as a physician, as someone who ran the county's clinic system, as a former associate dean at UC Davis Medical School, it's not the solution that I would have come up with, but it is now in place. And what we really need to do is move the conversation to identify what's working and build off of what's working, but then identify ways that we could fix it and make it better. And I still think the most important thing to do is to address the cost of healthcare. I mean, it is coming down per se, but we really have to get ahead of this. Otherwise, it still makes it very difficult to compete with the rest of the world if you have no control over healthcare costs. And again, that I can go into specific legislation, but that's where I think the focus has to go is how do we fix this, how do we make it better, and how do we actually make it more affordable?
Thank you. Next question is for the Assembly member. We have a question here about senior issues and specifically phone scams, and if there's anything that you're working on in the legislature or with your colleagues to protect seniors' identity and information.
Well, the biggest thing I've done regularly each year is put on a workshop related to this subject matter. And through my website, there'd be resources available for persons who have been subjected to phone scams. The state's attorney general is very active in providing help on this front. So I would say anyone who's experienced this sort of thing, you should feel free to reach out to my office, and my staff and I, we can get you specific information to assist. Legislatively, I think we've seen initiatives working with the financial sector, the financial industry, to increase education and resources to help folks dealing with this issue. It's an ongoing issue, and there's just an extraordinary amount of creativity people use to try to take advantage of people. So, you always have that maxim, if it seems too good to be true, it probably is too good to be true. I would actually say that anyone in this room, if you have an issue that you're worried about, I sort of think you could reach out to Ami Bera's office, my office, and honestly, I think the council members, though probably the congressional, Ami and I would have more resources to direct you to. But there's a lot of resources, and we've certainly looked to strengthen the capacity of financial institutions to deal with it. We've seen problems with, the Target breach, where people use their credit cards at Target, which would seem to be fine and led to losses. And so we've tightened up some of those practices in law. But this is certainly an area where there's an awful lot of basic rules that exist that can help you. In 2007, I put on the region's earliest meetings dealing with the mortgage crisis. And it wasn't actually plowing new ground. It was just actually in this room on December 12, 2007, and in adjacent rooms, because we did it in 3 languages, English, Spanish, and Russian, Donald Terry and other public agency folks came in just to give people advice on what to do if you were feeling this looming mortgage, what was happening in the economy, affecting their personal finances. And so I would just say, identity theft is sort of the same way.